Welcome back, everyone. Mix 1041. We're on mixtv.tv, and our friends in the Vascular Institute join us. Dr. Stephanie Sheridan is here. Dr. Sheridan, how in the world are you?
I'm doing great today. Thank you for asking. How are you?
Well, I'm doing good, and I tell you, every September we love to hear from our friends at the Vascular Institute because it's such an important month, Peripheral Artery Disease Awareness Month. And I'm just going to begin there, Doc. What is that? What is PAD?
PAD, peripheral artery disease, is a disease where patients build up plaque in their arteries, and that plaque can cause narrowing and decrease the flow to their arteries or their limbs. We normally think of, say, a heart attack or a myocardial infarction. That's where you don't have good blood flow to the heart. Well, for us, think about all the other arteries of the body. We take care of those things at Vascular Institute.
Dr. Stephanie Sheridan joins us at the Vascular Institute. So, just some numbers. How many people are affected by this?
It is affecting about 21 million people throughout the United States. And out of that 21 million people, 185,000 people will have an amputation because peripheral artery disease goes untreated.
My goodness. Well, and now let's talk about some risk factors as well as maybe signs and symptoms to look for.
Okay, risk factors of PAD are usually cramping or Charlie horses in the leg, usually when patients are trying to walk a long distance. My favorite saying to my patients is, are you able to walk through Walmart? Can you make it to the back of the store? People will find that they either need to lean on the buggy, or sometimes they find themselves just having to take the cart. A lot of our patients will suffer cramping at night when they lay flat. They will wake up with a severe cramp in the leg, have to get up and walk around. They may find that one leg is colder than the other. The foot may be a different color, pale, very cold to the touch, and numb. Numbness is very important with PAD. Also, they may have wounds that are very slow to heal. So say you clip your toenail and normally you go over and break the skin. That should heal in about 7 days. Well, these people will find that they have wounds that may be there like a month later. And so if you have those signs, you definitely need to come in and let us check you out and see what's going on.
Dr. Stephanie Sheridan joins us at the Vascular Institute. Want to talk about CLI, critical limb ischemia. Did I say that right?
You did.
Tell me about that.
Well, critical limb ischemia is when you get an acute blockage, and that happens more so in women. We found that they have more PAD. They're more at a higher risk for this, but those critical limbs can cause the patient to need an amputation. So we definitely want to be on top of that, and that goes right there with heart attack, stroke, and critical limb ischemia. That plaque builds up in the artery, and honestly, it keeps that limb from getting occlusions. And so our goal at VIC is to prevent amputations, so victory over amputations. So those are the things we need to see immediately.
And obviously, I guess why, and a lot of people say, why is PAD and also CLI such an issue? Why is it such a problem?
Well, a lot of people, about 40% of patients go without any symptoms. So they don't even know they have this disease process. So you have patients with these symptoms and they don't realize like the risk factor that kind of proceeds or brings them this way. We know that smoking is the main risk factor for PAD. There's also chronic diseases such as diabetes, hypertension, chronic kidney disease, and then there's advanced age. There's a genetic factor that still leads them. So if you think about all those diseases that I just named and we think about the population, you can see how prevalent this disease process could be. And if you have patients walking around without any symptoms, it's kind of a silent disease, and people are not aware of it.
And that's one reason we're doing this. Tell me about CLI fighters there at the Vascular Institute.
Well, our CLA fighters, that's what we try to be. We want to be out there fighting the community, trying to make people aware of PAD. PAD is very prevalent in our area, in this community, and we're sitting in the bend right here between Georgia, Alabama, and because of the disparities in our social economical climate, people don't realize they have these diseases. So we're here to fight this disease and make sure people are aware. PAD is 3 times more out there than breast cancer, believe it or not.
Wow. Well, I know we're joined by Dr. Stephanie Sheridan, our friend with Vascular Institute, and I know the theme this year is No More, which is KNOW, No More, and then No More Amputation. And, and as they say, and as my friend Tracy reminds me, really, they should come to you for a second opinion if their first opinion is amputation.
Absolutely. Absolutely. Our goal is to prevent those amputations. And we would tell anybody out there, if they have said that they can't do anything for you, please just come and let's talk about it. Let us see what's going on, what the disease process is. Like, we're the best, I would say, and the most prevalent and the only resource for critical limb in our southeastern region. So yes, please just give us a call and just give us a try, because our goal is to have victory over that amputation.
Dr. Stephanie Sheridan, doctor, it's so great to see you. And anything you want to add here before we go?
No, we have multiple locations. Just let me throw that out there.
Please.
We have a location in Chattanooga, Cleveland, North Georgia, Jasper, and Dayton. So any area out there, we would love to just kind of take care of you and, have you have victory over amputation.
Well, that's wonderful. And hello to my friends, the Lasars, Dr. Chris, and of course, Tracy Lasar, maker of some of the best cookies I've ever had.
Facts, y'all.
In my life. Well, listen, it's great meeting you, Stephanie. Thanks again. Dr. Stephanie Sheridan, everyone. Vascular Institute. We're so glad to have Vascular Institute here in Cleveland, right there off exit 27. Give them a phone call on this very